Hello all, I am Dr. Shashidhar Bilag, working as a consultant psychiatrist at the Brindhavvan Areion Hospital since the last decade now. So about psychiatry, now most of you people will have lot of opinions about psychiatry. Most of will be biased or preoccupied with, filled with myths and stigmas. Now, normally any patient who comes and meets me takes a period of 6 months to 1 year of suffering symptoms before he finally asks for help. Why is this gap so much? Because it is a thing of embarrassment for many people to approach a psychiatrist. It's high time in today's fast times where we should approach to a psychiatrist immediately whenever a person feels stressed, any other behavioral problems or emotional problems, we need to consult a psychiatrist at the earliest to prevent any further problems. Now, what are the problems we are talking of? Now, problems can be interpersonal problems, it can be work-life stress, it can be academic issues, it can be behavioral problems also. So, we here deal with substance abuse. Multiple youngsters today are getting into this web of substances where they can't come out of it. They are getting into one after another new drugs, so they find it difficult to get out of it. Now, parents are also finding it difficult to bring them to the doctor. Now, parents can also come by themselves and have a discussion on what they can do to help their children. Next is anxiety and stress and depression. These are very common these days nowadays. So now most of them, you see, suicide has become a very common thing nowadays. Last year alone there were 1,80,000 suicides in India. Now how many of them took help and how many of them could not take help? There's a high difference. Now all these people, if they had met a psychiatrist or a psychologist, maybe we could have saved them. So whenever somebody feels low or unhappy, talking to a shrink or psychiatrist or psychologist will always be helpful and beneficial, and there is no negative here. One more misconception about psychiatry is the worry about the treatment part of it. Medications are harmful, treatment will be costly, nothing like that. Most of the medications are safe and can be given adequately, nicely, without any problems in the patient, whoever he or she is. We also deal with personality issues, sleeping problems, eating problems, sexual problems, and in old days, memory issues, forgetfulness, what we call as a dementia. In children and adolescents, we have attention deficit hyperactivity disorder, autistic problems, and school refusal problems, going low on academics, not able to study like before, and today's thing is mobile addiction and gaming addiction. All these things can be handled, can be discussed, can be solved and resolved if the appropriate help is taken. One more common thing is today's sleep hygiene in India has gone for a toss. Nobody is sleeping at the right time, nobody is getting up at the right time. And this causes a sequence of events, not able to go to the work at the right time, not able to give time to the family. Lot of complications are happening, lot of arguments and happen. So any stress, any issues within the personal life, family life, interpersonal problems, occupational problems, or any other behavioral problems, like I forgot to mention about OCD also, obsessive compulsive disorder, you can always seek help. I can assure you that treatment here will be confidential and it will be free of any side effects or any that such worries should be kept aside and help should be sought. Thank you.